So thank you so much. It's about time. Allow me to welcome each and everyone to our second webinar series for the Girl Generation program. Today's topic is Girl-Centered Programming in Ending FGMC, a proof of concept in Kenya. And this webinar will focus on the work of the program's monitoring, evaluation, and learning by sharing the key findings of a proof of concept assessment done in Kenya. Today, our speakers will explain what the proof of concept assessment is, what we learned from it, and the resulting recommendations and next steps for the program. We will have time for questions from our participants towards the end of the session. This webinar builds on one we hosted as a program last month, which described the interventions being implemented in more detail from the point of view of our implementing partners and the people they work with, of course, in communities who are at the very front of the movement to end FGMC. The webinar is organized by Options, which leads the TGG ALM program with speakers from the Population Council and African Population and Health Research Center, APHRC. The aim of the webinar is to share findings and learnings from the proof of concept assessment with key stakeholders, which may have relevance for others who are working in this space or adjacent spaces. We are providing interpretation for this webinar in French, in Amharic, and sign languages. Please click the globe icon at the bottom of your screen to select your language of preference. However, for Amharic, please select the Korean channel, as our platform does not have an option for Amharic language. Please also note that this webinar will be recorded for external share. My name is David Kawai, the Community Implementation Lead for the Girl Generation program, and I'm based at Amref Health Africa. I will be your moderator for this webinar. A reminder to all of us, as we engage in this discussion and share our thoughts, let us be mindful of the sensitive nature of FGMC and all forms of gender-based violence and its impacts on survivors. We encourage that this space be an open dialogue, have understanding and empathy to create support to all survivors of gender-based violence. Let us all keep the language very respectful. Additionally, please prioritize your well-being. It's important. And feel free to excuse yourself if you feel distressed or otherwise. Your emotional safety is most important. So please listen at your own pace. We will also be recording this webinar, as I've said, for the purpose of sharing it with those unable to join us today. Now, at this point, allow me to take this opportunity to introduce our speakers for today. And today we have 3 speakers for this webinar. And the first speaker is Jane Meme, the Girl Generation Monitoring, Evaluation and Learning Lead. Jane, as I've said, is the Monitoring, Evaluation and Learning Lead for the Girl Generation Support to Africa-led movement to end female genital mutilation or cutting program. She has extensive experience in international development program, management and monitoring evaluation, accountability and learning, where she has led and supported various programs, including providing third-party monitoring services to various development agencies, Jane is an experienced qualitative researcher and holds a master's degree in program planning and management from the University of Nairobi. She has a passion for children's and women's rights, as well as social justice, and endeavors to contribute to programs that positively address gender and social inequalities. After Jane, Kenneth Juma will be speaking, and Kenneth Juma is an epidemiologist and a senior research officer at APHRC. His research focuses on adolescent sexual and reproductive health, maternal health issues, and the quality of maternal health care in Africa. He currently works in a multi-country program challenging the politics of social exclusion that focuses on the generation of policy-relevant evidence and supports its use to accelerate policy formulation and implementation around safe abortion, adolescent sexual reproductive health, and non-exclusion of sexual and gender minorities across sub-Saharan Africa. Kenneth holds a degree from the University of Nairobi, a master's in public health from the University of Oviedo, Spain, and a master of sciences in epidemiology from the University of Biao in Cameroon. Our final speaker will be Dr. Dennis Matanda, who is a research associate at Population Council. Dr. Matanda holds a PhD in international health promotion and development from the University of Bergen. Dr. Matanda's area of research covers maternal, child and adolescent health with extensive experience in the use of survey data, implementation science, and operations research. Currently, he's the deputy team leader of the FGM Data Hub project at Population Council, which provides data and measurement support to the African-led movement to end FGMC. Dr. Matanda led the systematic review of the effectiveness of the interventions designed to prevent or respond to FGM and the development of the global research agenda to accelerate FGM abandonment. Now, ladies and gentlemen, the format of this webinar is presentations. So please type your questions or comments on the chat box as we go on, and we will take time to open the discussions after the presentation at the end. We will now get into discussions, and I invite our very first presenter, Jane Meme, who will give us an overview of the proof of concept in Kenya and why it is important to take program and wider stakeholders in the end FGM movement. So welcome, Jane.
Good afternoon, everyone. I hope I am visible and that I can be heard. David, if you can confirm that. Hello?
You are very, very audible, very well. Go ahead, Jane.
Thank you. And good afternoon and good morning, everyone. I'm going to be taking us through what the proof of concept is. But before then, I will speak to the outline of the presentation that we have today, or the webinar that we have today. We will start by the overview of the Girl Generation African-led movement, support to the African-led movement program, what it's about and what we do. Then we'll look at what the proof of concept is, then what we learned or the findings from the proof of concept, and then we'll go to recommendations and conclusions. And then we'll have the answer and the question and answer session that David has spoken to us about. Next slide. In terms of the overview of the TGG, we call it the TGG. The full name is the Girl Generation Support to the African-led Movement to End FGM. The Girl Generation program is not the movement. It supports an already existing African movement to end FGM. So we do not claim to be the movement. We support an existing movement. The program is implemented in 4 countries in Africa. We have Kenya, Senegal, Somaliland, and Ethiopia. We do support In terms of what we do, we support community-based interventions aimed at ending FGMC in various locations. We also provide grants to community-based organizations to enable them intensify their community-based interventions or community-based activities. We also do targeted organizational capacity building of grants recipients for purposes of sustainability and keeping the movement strong and going well past the program life. We also support integration of FGMC into pre-service medical training curriculums to prepare health service providers for prevention of FGMC, as well as prepare them for providing care and support to FGM survivors when they get into service. We undertake strategic communications, advocacy and movement building activities across Kenya, Senegal, Ethiopia, and Somaliland, and also do complementary regional and global work. In a nutshell, we are building an evidence base on what works to end FGM by designing, assessing, and promoting girl-centered approaches at multiple levels. We are using the socio-ecological model of working with individuals, with parents, and the individuals here, boys and girls, parents, households, communities, health systems, national and subnational governments. So we work at all those levels to ensure that we are reaching every person or every level in the community that would contribute to ending FGM. So that is what the TGG does. Next slide. So what is the proof of concept? The proof of concept is about building, testing, and refining a small-scale end-FGM model which generates initial evidence. And please, I would want to underline initial evidence that change is happening in the right direction. And in our case, this means that we actually are getting evidence of positive shifts or positive change in social attitudes amongst the various target groups that we are working with towards ending FGM. That is what we would want to see. That is what the program aims to see. And that is what we test when we do the proof of concept assessment. So in other words, the proof of concept is like reaching the end of a pilot phase. It's actually a fancy word for pilot. In Kenya, we chose to do our programming in 3 counties, Narok, Isiolo, and Garissa. And in those counties, we chose to work in some wards. We do not work in the whole county. And in these 3 counties and these 3 wards, what we did is we started out small, co-creating community-led interventions to shift attitudes towards ending FGM, with the aim of scaling and promoting these approaches once there was enough evidence that we are actually shifting attitudes as intended. You might want to ask, why co-create? Co-create because we believe that communities that practice FGMC hold the keys to ending FGM. We also recognize and appreciate that there is local expertise in these communities, and that external entities such as ourselves may actually not be privy to what makes FGM continue in some of these communities. So we believe that communities have that expertise, and co-creating interventions with them would then lead us to a model that would actually work to end FGM. So the intent is, once we know what works, is for us to scale and promote that approach. And we do this by getting to know a number of things. And this is the criteria that we use to assess our proof of concept. Number 1, we look at if the interventions are leading to the changes that we intended. That is effectiveness. Are we seeing positive change in social attitudes amongst the various target groups that we are working with? If we are, then we would actually know that our interventions are effective. The other thing that we look at in assessing the proof of concept is if the interventions are what people want and need. And that is the aspect of desirability. Do people desire these interventions? Are they with us even as we propagate these interventions? Do they feel that this is what they actually need? This is what is needed in their communities? Then the other thing that we look at is, are they doable and are they practical? Are we coming up with such complex interventions or models that post the program life, the interventions die with the program? So we want to be sure that they are doable. We want to ensure that they are practical, that somebody else can pick them up and actually implement them in another context. The other thing that we look at is if the interventions are sustainable and can be scaled in other places, so that whatever has worked in Narok, in that small village in Narok, if you took it and went to Kuria and made adaptations for the environment, then you actually get the same results. So that's the other thing, viability. That's the other thing that we are testing. If the interventions are sustainable, that they will outlive the program, that the people who are within the communities will actually be able to continue with these interventions well past the program life. Then we are also a girl-centered program. So of course, we want to know if the interventions are girl-centered, because for us, the girl is at the center of everything that we do. We also want to know if these interventions are locally led for purposes of sustainability. And we also want to know if we are adhering to safeguarding and do no harm principles, considering how sensitive the matter of FGMC is. That is the criteria that we use in assessing the proof of concept. Next slide, please. So how did we, because we did the assessment in Kenya, how did we assess the proof of concept? We reviewed monitoring, evaluation, and learning data from 2 years of implementation. We looked at survey data from surveys that we are done with school clubs, because we have school clubs that cut across all the regions where we are working or where we are testing. We were testing the model. So we looked at that data in regard to knowledge, beliefs, and attitudes. We also looked at pre and post tests scores from university faculty and students in relation to integration. What feedback were we getting in terms of what they were saying about integrating FGM into curriculums in the training institutions. We also looked at the social movement scorecard. This is a tool, a participatory tool that we have used to track changes in collective efforts to end FGMC, or rather to establish the strength of the social movement, because this is what is going to keep the momentum of ending FGM going. So we administer a scorecard and we looked at the scores in terms of how is the social movement doing. We also looked at qualitative data from community members, including program participants and staff reflections. In total, we did 24 reflection and workshop and feedback workshops with over 500 participants to provide us feedback of our model and help us determine whether we had achieved a proof of concept. In other words, we wanted to know from all the participants that came to our workshops if there was sufficient evidence that attitudes were shifting towards ending FGM in the areas where we were working. We involved girls, we involved boys, community members, community leaders, county government officials were involved from various departments, and also community civil society organizations working in the localities where we are working. We then invited an external reviewer to come and help us in terms of processing the data that was coming from all these workshops at the African Population and Health Research Center, APHRC, who are here today to also help us in presenting the findings. That is the overview of the proof of concept in Kenya and how we did it. And back to you, David. Thank you very much.
Thank you so much, Jane, for that very wonderful presentation. Now, at this point, we shall now take a deeper dive into the proof of concept findings. And our presenter for this session is none other than Kenneth Juma from the African Population and Health Research Center, APHRC, which Jane has just alluded to. And he will take us through the key findings. Over to you, Ken.
Thank you very much, David. My role is to summarize some of the key findings from the key interventions of the TGGL ALM program. And to begin with, one of the key interventions were the school clubs. And really taking a look at the school clubs, they did, to a great extent, improve knowledge and also drove positive attitudes and beliefs amongst both boys and girls, but also to a greater extent improved empowerment and self-esteem and agency, particularly among girls. And of course, while this happened across the three countries where the interventions are going on, there are varying variations to the degree with which there were changes in knowledge and also shifts in attitude. Secondly, was that the school clubs led to enhancement of confidence by girls who are now able to speak more in public, openly about this sometimes very difficult topic, but also beyond that at home, be able to negotiate with their parents to remain in school. This was important because retention in school is recognized as a key protector of girls from FGMC. In addition to that, and remarkably, the school clubs led to the nurturing of FGMC champions amongst not only girls, but also girls and boys. And in this case, girls and boys were seen as now increasingly educating and protecting their siblings, family members and peers from FGMC, and also recruiting others to advocate for FGMC. And some of these narratives or manifestations of these changes are depicted in the quotes that are on the right of my screen. In addition to that, children are also seen as being able to report girls at risk of FGMC to adults and also the authorities. And this came out much more clearly when cutters themselves were said to avoiding families where girls and boys are engaged in these school clubs because of the risk that if they're exposed to FGM, they would actually report the cutters to the authorities. Next slide. Now, this is a spotlight of changes that were seen in knowledge, attitudes, and beliefs amongst girls and boys who are in the school clubs. So there was about an 8% change in knowledge from baseline to about 6 months later when an endline was done in terms of the level of knowledge around FGMC among the school-going boys and girls. In terms of attitudes, there was about a 6% shift in attitudes around, again, the same topic amongst these boys and girls over this 6 months period. And we see a similar change in beliefs, while lesser than what we saw in knowledge and attitudes, but there was a modest change in beliefs. As we know, beliefs take time to evolve and shift, and this is clearly shown in these findings. Next slide. Now, when we look at another set of interventions that were at the community level, these were the community dialogues. And the community dialogues involved both mother and daughter forums, intergenerational dialogues that included both young men and women, and also older men and women. There were also dialogues with men only. And what we saw from the community dialogues was that there was an overarching shift in the framing of FGM in the community, wherein leaders and even community leaders and religious leaders and former cutters would consider FGM as a non-religious issue and against religious teachings, but also as a key driver to school dropouts and also a violation of human rights and violence against women. So these were emerging shifts at the community level by people who are ordinarily gatekeepers and who are responsible custodians of this community or cultural practices. At the same time, dialogues are seen to reduce stigma towards the women who had not been cut, who initially would be seen as outcasts and not part of the community and be referred to with derogatory names. So it tended to reduce those stigmas within the community. And at the same time, it also created a safe space where everyone could speak about FGM. And The conversations would involve both men and women, and women were also seen to be able to make decisions around whether to protect their girls from cutting, and also involving the men in such decisions. So there was a remarkable increase in safe spaces for women to make decisions around whether or not to include or to involve their girls in FGMC. Again, at the same time, just like we saw in school clubs, there was a remarkable sort of enhancement or generation of anti-FGM champions at the community, and this was in two ways. One was persons who were already identified as champions in the community, so conducting training and educational forums and awareness forums, were both, there to facilitate dialogues, but also act as reporting points. But at the same time, within the community, individuals such as border riders, people who drive bikes to transport people from one point to another, also becoming activated and refusing to transport cutters who would be wanting to use them to move from one village to another to facilitate the cuts. So again, some of the highlights of these changes at the community level are captured in a quote that is on the right of my screen. Next. Now, there are also grants that were given to community-based civil society organizations, and the effect of these grants are as follows. One is that there was an empowerment of civil society organizations at the community level to lead, their own ideas around FGMC initiatives that involve communities and would penetrate some of the communities where perhaps the lead organizations would not be able to penetrate because they work directly with those communities and they're part of that community. Again, apart from that, there was strengthened leadership across these, as we know them, local, community-based organizations to lead and be able to manage some of these grants, some of whom this was their first grants, of support to enable them conduct their activities. At the same time, this work at the community level was able to galvanize change agents and village monitors who could be able to identify girls who are at risk and facilitate reporting, especially for violence or those who are at risk. Again, there was an emergence of survivor-centered approaches, again cultivated, in the community, and these were emerging really from the community dialogues. What we also recognized across the 3 different counties where the TGGLM program is based is that these grantees, who are again local organizations, could be recognized by the county authorities and be involved actively towards any policy and policy-making processes at the county level. The grantees have also been quite active on social media and radios and other mediums of information to be able to disseminate information around awareness and also to reach various audiences on this topic of FGMC. Next. Well, at the county level, to which, again, the program was working with the county leadership, there was a lot of technical advocacy and support offered by a TGGLM program that has sort of galvanized and strengthened policies and commitments at the county level. Across these counties, in the life of this program, there's been a strengthened sort of implementation of policies that are existing. And at the same time, there is measurable progress in social movements across these 3 counties, and even journalists have been trained. And the training of journalists has led to the increased publication of information and evidence or data in a manner that protects survivors of FGMC and do not necessarily enhance their stigmatization. At the same time, there are several networks that have been established or strengthened with the TGGLM support. A cohort of FGM survivors who have undergone training has been formed, and they've gone ahead to form their own network that is linked to survivor networks in the program countries and also in Kenya, and it is recognized by the anti-FGM board. Of course, there's Meant for Change networks There are youth networks of varying forms across these counties, and a national civil society coalition that aims at ending FGMC. I think that is the end of my presentation. Thank you. Over to you, David. Okay, one more slide on the integration. Looking at the learnings from TGGLM, ACCF has gone ahead to train more than 160 lecturers and teachers in Kenya who have been taught various strategies around prevention and response to FGMC, and also developed a curriculum that has been passed on to more than 1,800 health students and universities. And some of them have gone ahead to really be active players in making sure that FGM is eliminated or reduced remarkably. The pre and post-test training results have shown a great improvement in results in terms of knowledge and confidence around FGMC prevention and response. At the same time, the training module or approach has been scaled up within Kenya, and there are efforts to scale it up to other TGGLM countries. And finally, the training has really motivated students to become activists in the movement beyond just their roles in health work, but also in the societies and communities where they live. Thank you, David. Bye.
Okay, thank you very much, Ken. That was quite something. And I want us to move forward and look at what recommendations, what challenges did we get. So our next presenter to handle that is Dr. Dennis Matanda from Population Council, and he will be taking us through the key recommendations and even challenges from the proof of concept, and also talk about the next steps for the program, TGG-ALM. So welcome, Dr. Matanda.
Thank you, David, and thank you to also my former presenters. So mine is to take you through some of the challenges, better call them some of the learnings rather than challenges, and what we recommend given what we have implemented so far. So what are some of the learnings and what are some of the recommendations that we can make given the interventions that we have implemented that my former colleagues have really put it and explained it very well. So some of the things that we have learned is that in relation to the school clubs where this has been implemented, dealing with boys and girls, is that in these school clubs, the clubs sometimes tend to be seen as girls thing, like dealing with FGM, which of course directly affects women and girls. But as we all know that it's a societal kind of like, there are other effects in relation to the bigger kind of like community rather than just girls. And therefore in these clubs, we've also seen that there's a little bit of stigmatization of those boys who kind of join these clubs because then they are looked as, why are you going to these clubs that deal with issues to do with women? So that is a concern. And some of the recommendations that we make from there is that it is very important that we do increase the proportion of boys in these clubs. That way, then they are not seen as a minority, but more importantly, that we ensure that there is early engagement and meaningful involvement of boys in these clubs. So that's very important in creating a safe space even for the boys who decide to come and join the clubs. The second learning that we also see, given the implementation, is the feeling that there is limited engagement with children during school holidays. We all know that we are dealing, most of these interventions, especially school clubs, targeting schools when these children or boys and girls are in school. But schools do close, and these boys and girls go back to the community. And we all understand that, especially during school holidays, when schools have closed, that's that's the time that FGMC usually happens in most cases, and therefore it is an opportunity, a high risk kind of time for FGM to happen. And therefore, it's very important that we do intensify school holiday activities, interventions where we're bringing together these girls and boys when they're out of school. The third one is also the feeling that men are not adequately involved in the program, being perceived in certain places, because then you tend to target more women maybe than men, and also the issue of over empowerment, and we're putting it here in quotes, of women, which sometimes can make men feel some imbalance that is happening. But the way we are recommending here is that we need to bring men on board as allies, and meaningfully engage them, but also not giving up the spaces and the resources that specifically are supposed to target women and girls, because that's the population that we really want to involve in our programming. But also some of this could be as a result of men trying to push back what you call the shifting of power, in terms of if women you're improving their agency, you're increasing their knowledge, they are able to stand up for what really belongs to them, or stand against some of this violence that is meted against women. It's a good thing, but we need to also be considerate that we need to bring men also on board, so that there's no that kind of like backlash. The other learning that we also see, also in some families, take the girls from the project areas to neighboring villages for FGM. So you can call it cross-border, and cross-border can happen either village, either district, or between districts, or between counties. Basically trying to avoid, given the interventions that are happening in some of the intervention sites, then because of the awareness and people being woke, then they may decide to take these girls to other places, probably where interventions are not happening. And therefore, it is very important that we do advocate for scaling of some of these interventions to the entire county, for example, so that we can be able to reach a bigger target population, and also increase the safe space, including through governments and also religious leaders and congregations. The last challenge, though I want to call the blendings, is the issue about that just like in any populations, that you'll still have some certain kind of like pockets where some groups still remain kind of like with fear, still hold into certain beliefs. And in this case here, there are certain beliefs that the issue about being cast if you do not undergo FGM. So this is a theme that also emerged from some of our learnings. And we do recommend that there's further research, and for us to be able to have a deeper discussion in relation to what exactly is the understanding at community level, but more importantly, how can we be able to shift some of these highly context-specific beliefs. Next slide. So in conclusion, there are three things that I wanted to highlight given the presentations that have been made so far. Conclusion number one is that having gotten the feedback that we've gotten so far from either community at county level and national levels, because those are the levels that we try to engage when we were trying to prove the prove the proof of concept, is that all this feedback that we have gotten from these different stakeholders do affirm that the interventions, the approaches that the TGG-ALM is implementing, there's some pointers towards its effectiveness, and that the program it's being supported by, and this is being supported by the evidence that we have continuously generated, either through monitoring as we implement and learn and course correct, but also from evaluations that we have done as we implement these interventions. The second conclusion that we also can make from the proof of concept so far is that interventions that we are implementing are desirable and feasible, given the approach that we have taken. We can see that most of the interventions are bringing positive change. They are very practical because we really design with the people on the ground, and they also kind of like very context specific in terms of its design, focusing on specific groups and also at different multiple levels, the socio-ecological kind of like levels. And also related to that, I think, is the conclusion that looking at the different multi-pronged kind of like approach, focusing at different levels of the socio-ecological model, be it working with boys and girls in schools, that's maybe at individual level, working with communities, conducting community dialogues, the grant mechanism at a system level where ARCAF is dealing with issues about integration and the health system, training institutions, also movement building, and also at policy level and advocacy. We see that these different kind of like levels are creating what we call champions and change agents that as we look ahead in terms of sustainability, that we can leave behind to bring the change that we want to see. Next slide. And just to finalize, is that what are some of the takeaways, the so what kind of like question given what we have implemented now? And one is the issue about the girl-centered programming, putting the girl at the center of our interventions is really a powerful entry point for action to end FGM. And therefore, reflecting the girls that are the most directly affected in form of violence, we see that it's an approach that can be adapted across different forms of ending violence against women and girls. And there's a practical way, a practical tool that really explains the girl-centered programming approach that you can find it on our website if you're interested. The other aspect is also in relation to the socio-ecological approach. This was very key for us. We started it even when we were developing the theory of change before the program even started, and looked at how can we end FGM by looking at the different levels of the socio-ecological model. And therefore, it is very important that we approach the issue of FGM looking at these different levels of society. And these interventions need to be implemented in a simultaneous manner to be able to end violence against women, including FGM. The third takeaway is the issue about locally led change. This is very, very important. It's critical. And as you have seen, most of the interventions under the TGG ALM, most of the partners, these interventions are implemented by people, local champions, local patrons, either if it's at the university level, the faculty. That way, then we are able to increase the issue of sustainability, and the change is locally kind of like driven. Then the last one is us just to be aware that change does not happen in an instant. It takes time, and therefore you'll still have in a community people who still hold onto certain beliefs. Maybe they're still supporting, or their beliefs have not shifted as much as maybe we would have wanted. You will also have in certain changes that maybe might not be positive. For example, the change cutting more younger girls, or it being more secretive rather than being public, or issues about medicalization. And therefore, it is very important that we do evolve as people who are doing programming, so that we are able to address these emerging challenges or emerging issues. So thank you very much, and back to you, David.
Thank you very much, Dr. Matanda, and to all presenters for managing time extremely well. That gives us some space to ask questions. So to all our participants, we are here. We want to respond to any concerns that you have. And so I open this space for questions. You can type your questions on the chat box, and we will pick them. Our presenters will be ready to answer the questions. And some of the questions will be responded to in the chat. So feel free to type your question in there. I will be reading some of them and asking specific presenters to answer. And as you type your questions, allow me to just read some comments. I hope I'll be able to access the chat box. There are many comments here. We have about 10 or so minutes to ask and respond to questions. And there is a question here about whether the police were involved in the proof of concept or even in the interventions. Yeah, that's a great question. That can go to Jane. Jane, prepare to take that for us. Were the police involved in the proof of concept and in the interventions? We have a compliment from Hannah. This is very good research. Thank you, Hannah. We also have a comment from Eric. Locally led interventions have promoted ownership of the program. For example, the CSO Network Coalition on End FGMC in Kenya. I agree with the proof of concept and the findings and the learnings and recommendations. Thank you, Eric. We have another one from Denga. Any chance the valuable learnings from this project have been published somewhere? Where can we get them? Or is it too early? I would love to read more on this model. Dr. Matanda, would you mind taking up that one? Respond to that. We have a long one here, and allow me to read it. It's valuable. My name is Duncan Kiprotich Kagor from Baringo, representing Baringo. I believe school clubs can play a significant role in helping to end female genital mutilation by providing a safe and supportive environment for students to discuss and learn about the harmful effects of FGM. Through these clubs, students can develop life skills such as critical thinking, problem solving, communication, which can help them make informed decisions about their bodies and health. So additionally, school clubs can provide a platform for students to share their experiences and support one another, helping to break the silence and stigma around FGM. Thank you so much, Duncan, for that quite educative comment. We have many more comments, but I would want to hear the voices of our presenters. We can start with Jane about the police and come to Dr. Matanda about where do we get more information. Thank you. Over to you, Jane.
Thank you, David. In regard to the question about whether the police were involved, I want to start by appreciating that question because the police force, as it were, is actually a key partner and also a key collaborator in getting to end FGMC. In the counties where we are working, and just like in every county in Kenya, you'll find there is agenda working group that is usually chaired by the county commissioner. And in there, you'll find that the police are actually represented. Just to give you an example of Narok, Narok is one. The county administrators are upfront, ensuring that the work has the requisite support, and that is through to the chiefs, and they actually do follow up. Also, in regard to groups. We also have gender desks. And the gender desks are usually the ones where you find issues of child protection cases addressed. If you go to a police station, you have such an issue, that is your first point of reference. That's where you'll be referred to. Police officers that man the gender desks is a part and parcel of what has been going on. So in as much as we may not have to every police officer, the relevant ones, according to the structures that have been set, are actually involved in the work that we're doing. They have been very, very supportive. And you cannot talk about the police without talking about chiefs in this country, because we know the chief, the chiefs have their own security that they are assigned. You'll find that almost every other major chiefs come as police officers, and those are the first ones that respond when there's an issue. Sensitizing those police officers has been key to this program, where when an incident is reported, they are the ones that work with the chief to ensure that if there's an arrest that needs to be made, or there's a response that needs to be actioned, then they action it. Thank you very much, and I hope that that answers your question. And yes, we can do more in terms of involving the police, but there has been deliberate effort to ensure that the whole administration is involved in that process. Thank you.
Yeah, thank you, Jen. Before Dr. Matanda comes in, and I see we have posted the link for the POC report. So participants, you could look at the chat box and open that link. You will get the report. I see many more comments coming in here. Thank you. That is Kate. Thank you for that very interesting presentation on this very important research. Thank you very much. That is Jacqueline Soipan, ALM. Thank you so much, ALM, for your great support to NFGM. Kindly consider all schools in the hotspot areas. Dr. Matanda, you can tell us how possible is it to address, all school in the hotspot areas now that the link is posted? And what about school children out of school? How are we reaching them? And Penina says, to end or eradicate FGM, I think NFGM network should involve men mostly in this fight. They are the voices of our homes. And once they say no, nothing can change that no to a yes. Nothing can change that no to a yes. And since they say yes, it gets hard to fight. And if they say yes, it gets hard to fight FGMC. Thank you, Penina, for that very great comment. And we have maybe a final one here from, this is Senegal, from Corey Sene. There is a fairly innovative strategy that was shared by a grantee in Tambacounda. So we will also be learning, from other countries. We will, the report is very detailed, and perhaps there's a new POC coming again from other countries. We'll be able to read what is happening in other countries. So maybe Dr. Matanda, you have something to say.
Yes, David, just to appreciate those very important questions and comments. Mine is just to say that we do use different platforms to disseminate this information, and part of those kind of like platforms is, of course, making sure that all the reports, findings that we get from our learnings are able to be shared freely, freely available online. Therefore, if you visit most of the websites, the TGGLM website, if you come to the Population Council FGM Data Hub, you'll be able to access all the evaluation reports, our learnings, the stories of change, all those that will enable you to be able to have a good understanding of what we are doing and some of the learnings that we are getting, because it's very important that we learn from each other. The other question in terms of involvement of schools, I think the main focus of this project is to prove a concept. Therefore, you are trying out kind of like a pilot of these different interventions and seeing whether they work or not. And at the end of it all, you want to ensure that it's sustainable and it is scalable. And therefore, it's not necessarily for the ALM, TGG, or options, or for them to be able to scale it to other areas, but to be able to share some of the findings in terms of these models that they are trying out, that they're showing that there's some change that is happening in those contexts. So how can other people who are doing programming learn from that and scale it and use it in their different kind of context? So if it is about rolling it out in other schools, conducting other community kind of like dialogues using this girl-centered kind of like approach, that's where we are looking at in terms of scaling. So scaling is just not about the ALM adding more schools, but it's about how can we learn and other programs or government or other institutions be able to scale some of these interventions that have been proven to kind of like work. I hope I've answered that question, David.
Yeah, thank you, Dr. Matanda. As always, a very good response and very clear response there. And allow me to thank everyone for the great presentations and to thank you all participants for asking great questions, giving us great comments, appreciating the POC findings. But when I was listening, I was reflecting and I asked myself, how essential is it to work with many different levels of society and with different groups when it relates to shifting social norms? Oh yes, this requires a lot of efforts and can take more resources. But one organization does not need to do everything. We can organize ourselves. Different organizations can focus on different target groups, or even on the policy work or working with health systems. And together, if we have a shared focus and shared principles, we can do more than we can achieve alone. The powerful potential for starting this work with the girls and survivors of FGMC is so clear. We know that successful social movements are always led by the most affected by the issue. It's the same with FGMC. So how can we help girls and survivors to take the lead without burdening them with the responsibility of ending FGMC by themselves? The Girl Generation's work in Kenya gives us some really practical examples on how this can work. With this, allow me to inform you that we will have a next webinar, and our next webinar will be on the 7th of November this year, 2024. And we will deep dive into our girl-centered programming tools and testimonials. We will dive deeper into how a girl-centered programming approach can be implemented in diverse contexts. Look out for more information as we move closer to that date. We encourage you to visit our website, www.thegirlgeneration.org/resources, to find more tools. And some of these tools, I'll just mention a few, and the website, of course, will be posted on the chat. Go to the chat, you will get the website. These tools include the proof of concept from Kenya, which has more information and on our discussions from today. You know, what we have discussed is already there. You will get it. Girl Club Facilitation Guide. We have that Girls Club Facilitation Guide. Very useful document. A guiding framework for girls-centered approaches to end FGMC. Very, very useful framework. Guidelines for engaging with survivors, you know, and that's very useful, even for issues to do with, you know, safeguarding, do no harm. You will get, you know, guidelines for engaging with survivors. And then we have a learning brief on grants mechanism in Kenya, and you see how we have implemented, grants to grantees on the ground to end FGMC. Now, kindly see the chat box, for the necessary links to these tools. I encourage you to follow us also on social media platforms. The different handles have been posted also on the chat box. We are on Facebook, we are on Instagram, and also we are on TikTok. Yeah, all that at the Girl Gen. You will find us there.